We should see this COVID-19 business as simply an opportunity to hone and refine our ability to protect life. We should view it on a micro level as well, because this notion of public health has been pushed to no end by some people, by some plutocrats, by some bureaucrats, by some technocrats in certain professions that are saying, oh, we have to shut down the economy to protect public health. Public health this, public health that, public. Let me give you a secret. Health is an individual condition. Health is the description of individual conditions. Health is not a public thing. It is a misnomer, a philosophically corrupt one at that, because it is being used to pervert the idea of health into something that it is not, to dare suggest that the health of one is the health of many. That's not true. When I go to the doctor to get a checkup, he doesn't ask me, okay, Christian, what is the blood pressure of your community? Because that'd be nonsense. That doesn't really tell me anything. He may want to evaluate my family history so he can get an indicator, an idea of how my blood pressure might be, but that's not going to be the sole determinant of that. They're going to take a test, and they're going to see my individualized condition so they can best help me, as Christian Watson, not a member of the Watson family, not a member of the nation, not a member of the community, but as Christian Watson. As Christian Watson. That is what health is. That is what true health is, ladies and gentlemen. But when the government tries to convince you that public health is in peril, and therefore to protect public health, we have to begin tracing people, and then the WHO actually sent an ultimatum to the government, United States government recently, and said, if you don't be in contact tracing people and, quarantining them mandatorily, you're going to see a second wave happen. All this nonsense, all this sheer and utter bile that comes from an organization that does not have any sort of conception of liberty, any sort of conception of self-reliance, any sort of conception of individuality, that comes from an organization who has been paying lip service to the Chinese, that comes from an organization that has been doing so many things that have been regressing our fight against this virus, our war against this virus. When it comes to that, unfortunately, my friends, when it comes from that, you're not going to get anywhere. Unfortunately. You cannot have someone who misunderstands a foundation of a house build a house, or else that house will cave in, ultimately. Endlessly. Tragically. It's unfortunate. It's terrible. It's fearful. But the problem with this COVID analysis is primarily how we are not seeing it as an opportunity to focus on our individual health, as an opportunity to focus on our ability to protect life, on an opportunity to focus on how we can change narratives and thus liberate us from the specters and the icy cold touch of fear that has been used time and time again to subordinate people to certain presuppositions, to certain preconditions, to certain actions. We should be focusing on COVID as a vector for change, not as an harbinger of destruction. We're fighting COVID. COVID's lethality is incredibly low compared to most viruses. And even more so now that we have we're using medication and certain drugs to combat its effect on the human body. We are quite literally kicking this disease and subordinating it beneath the hill of victory that is so integral and inherent to that Promethean human spirit that blaze forth truth and knowledge and disperse with illusions and disperse with falsehoods. We are quite literally liberating ourselves from the specter of fear and ignorance that we had back in March, back in April, that caused us to do so many calamitous things to our economy and our society, and we are finding a better path. But there are folks who want you to think that because at the start we had some issues fighting this thing, in the middle of the game, we're going to have more issues. There are folks who want to necromantize the past, and this is the past 2 months ago, and use that necromantic curse of the past and put it onto the future and thus entrap us all into that spirit of stasis. That's the government. We have to liberate ourselves from these mindsets, folks. If we want to actually get better, if we want to actually become healthier, you need to understand that your health is in your hands. Yes. Can COVID affect people other than you? Of course it can. Which is why you need to be careful And you need to take the precautions that are necessary for you to be healthy. Because if you do that, you are not affecting other people. I'm putting emphasis on the word you because it is ultimately an individual thing. If individuals were to be healthy, theoretically, were to stay healthy, and were to take precautions, this nonsense about public health wouldn't even exist because there wouldn't be a widespread effect of this thing. But unfortunately, partially due to ignorance, partially due to obliviousness, some of us just didn't know that COVID was going to be a thing. Well, there were folks who knew, but really, the government really didn't do much about it, or really, I mean, when they did, they didn't really help anything. I mean, lockdowns don't really help anything. Oh, but we were flattening the curve. You know, we flattened the curve by actually understanding it, not by actually force people into lockdowns and taking away their businesses and making them dependent on the dole. That's how we actually flatten the curve, guys. Anyway, if you want to beat COVID, beat bad mindsets first. COVID is an infection of the body, but the way we think about it is an infection of our mind, and that portends much worse things for us as individuals and Americans who are progenitors, who are emissaries of the American experiment in this era, in this time, in this age, in this moment. That portends bad things for us. We need to behave responsibly, behave intelligently, with the light of illumination that we have been given, that spark within us, if we're ever actually going to fight COVID and win and beat it. Because COVID can go away, but if the fear of COVID is still around, you will never see life return back to how it was, or life evolve to a higher order thing. You always see life stay in the trenches of fear and despair and death. And we don't need that. We really don't need that.